PBF slide preparation. PBF is used to check the morphology of blood cells. Requirements of a PBF slide preparation is an EDTA sample. We have our capillary pipettes. We have our frosted slides. And we have our spreader, which is a cleared slide. Then we have our pencil used for labeling. Using a well-mixed sample, apply a drop of the sample using a capillary pipette to the frosted slide. Using the other slide, which is our spreader, at an angle of 30 to 45 degrees Celsius, gently spread the sample to get a well-smeared slide. The angle of the sample varies depending on the HB of the patient. For a very anemic patient, you increase the angle. So for a very anemic patient, this is how we are going to do it. You pick the sample. The volume also varies. You put little amount depending on the HB. So I've said for a very anemic patient, you increase the angle. So you increase the angle slightly higher than the normal HB. For samples with high HB, polycythemic samples, that is newborn samples, your angle while spreading will be reduced. You label the sample with two patient identifiers, that is the name and the number depending on the facility. It can be an accession number or a visit number, that is GENDO 1, 2, 3, 4. Air dry the smears, fix with methanol for around 5 minutes. Stain if the sample are to be examined at your lab. If you are referring the smears to our lab, we'll need 2 well-spread air-dried smears and 2 fixed smears are recommended. Examples of a well-made stained slide. So this is an example of a well-made stained slide. It has the head, the body, and the tail. The tail is evenly distributed, as you can see. So example of a well-made fixed slide. This is a well-made fixed slide, labeled. So it has a head, the body, and the tail. So I'm going to show you some of the poorly stained and unstained slides. This is our example of a poorly made stained slide. There is no tail. So this is brought by not putting the correct angle while spreading. Another example is this one. So those are poorly stained slides. So poorly fixed slides, we have this example. As you can see, this is an issue with the spreader. Not having a good spreader can lead to a serrated tail. So this is a poorly spread slide.